Gentlemen, ladies, and my fellow beings out here. I have been told that it's an open topic, but I have also been told that if I can speak something about customer satisfaction. Now, I hail from a company that primarily works towards ensuring that we make India much healthy from where it is and from where others have kept it for them. India is a country, or any other country as a matter of fact, can only improve if there are two parameters being taken into action. One is education, and the other is healthcare. And I'm sure all of you would agree on that. And probably for that, your parents thought about education, and your parents think about healthcare. That's where we come from. Unfortunately, when we do enough amount of research work in the country, we find that Indian healthcare have been operative on a sucking mechanism towards ensuring that OP patients or normal patients are being stripped by the expensive medicines and drugs. It's not only sad, it's a sense of terrorism that India have undergone towards the expensive medications that have gone through. Disease like diabetes, cardiac, peds, gastro, nephro, etc. For people who are having geriatric parents and for the villagers, they know that it's not easy for them to afford high expensive branded medicines. Unfortunately, that's what India have seen. And that's what India have seen, and that's what India also sees now, unless we really thought that it's time that someone steps up to make India understand from a private perspective. Of course, the government is doing its own part, that generic medicines and high-quality generic medicines are the say of the country. That's where Dawa India comes into action. But more than that, it's a crime when a mother really cannot afford branded medicine and the child cries. It's a crime when someone who is diabetic, they cannot afford expensive medicines. And today we find the similar chains coming and saying, hey, we also sell generic medicines. When we do research, they say that, or consumers, they ask, where were they so long? Then was it that they were selling expensive medicines to us so long? That's a big question. Gentlemen and ladies, it's time for you to think, and think the truthness of the whole phallology that actually goes behind the story. There was a time when getting a credit card was too expensive, but a very affluent families could get a credit card, and today it's no more like that. And those credit card companies who played the monopoly are probably not that much available in the country because others are there. That's exactly what unfolds in Indian healthcare. Those companies, those chains who used to sell branded expensive medicines have done that with the O, where those mothers, those children, those diabetic patients, those cardiac patients could not have afforded those medicines, and that's the truth of life. And there was none to address that. There is where we come into action. To spread all across the country our network and to penetrate so deeper that those chains, those stores who used to sell expensive medicines, we go and say them that, look, it's time for you not only to do business, but to actually think customer first. By only saying customer first, you don't mean by that. You only mean if you truly believe in the ethos and values of the same. If you truly believe on the basic ethics and the perspectives of the outcome of the same. And if you cannot do that, that's just a political statement of a talk story. And there is where we truly believe that India need to be much more healthy. India need to get the access of very high quality medicines. And there is where we are unfolding a new India. And there is where we are building an India that would not only be healthy, but that would also understand the power of the new generation activities of medicines that is coming through generic. And that is what India, and India at large, in urban and rural, is unfolded by us. With this, I leave the platform open for all of you to think that it's time for all of you to think that it's truly customer first that we need to operate. Jai Hind.